Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Wednesday, May 20th. Let's take a look at the numbers from the 8 counties in the capital region. I will remind you these data points are 2 days old.
That's right.
So today is Wednesday, so these are numbers from Monday. We can see that the number of people who are currently in the hospital in those 8 counties is 114 with COVID-19, and that number is up only 1 from the day before. The number that are in an ICU bed are 19, and that's down from 21. So basically about the same numbers from the day before.
Pretty flat, Dennis. Yep.
Here's the grid of cases inside here at the medical center. You're familiar with this graph now. We have 48 in the hospital that we're currently treating for COVID-19. We have 42 on the floor. We have 6 in an ICU. We have 4 on ventilators. And Fred, if I'm not mistaken, when we were taking care of the most patients in the hospital who needed ICU beds, there was a time I think we had people in 6 different units.
Six different units. So our pediatric ICU, our CCU, our CPS, our MICU, our D3 North, and our surgical intensive care unit.
And today we only are using one. One.
Yeah.
So that's
remarkable
wonderful news.
Change.
And we'll pick up on those numbers tomorrow. Inside that number, though, we want to talk about the people who are coming from congregate living facilities. We've talked about this all week now. I think that number is 35, Fred?
35 out of 48. That's right, Dennis.
Okay.
And a good number of those patients are not acutely ill, so they've had their illness. We've treated them. They're ready to go back to their nursing facility or their group home, but they can't because they remain COVID positive. And that's a fairly significant number. We've been calculating something called avoidable days.
Avoidable days.
And what that really is days spent in the hospital where a patient could have been discharged already.
They no longer need the services of the hospital. They're
Correct.
No longer medically acute.
That's right.
And we can't discharge them because?
They're still COVID positive, and there's now that rule that they can't go back to a nursing home or a group home.
And just to remind people, we think sometimes, we know in fact, that the COVID-19 test can remain positive well beyond the time the person is even being treated for it or they're sick from it.
30 or 40 days out, and we think that's dead virus. That's not.
Explain that just a little bit more.
Well, the virus gets into your nasopharynx.
Yes.
You go through your acute illness, and it doesn't get completely removed. So you can still measure it through the PCR test, which just measures a fraction of the RNA.
Yes.
But there's at least one study out there that says you can't really grow it anymore,
Right.
and so it's not live.
So the test shows the presence of the virus. The person is still here in the hospital.
A portion of the
portion
virus.
of it, right.
And they're still here in the hospital, but not acutely ill, not needing our services. So today, here at the medical center, we have racked up 55 avoidable days. And we've been calculating this and measuring this for some of the other hospitals on our morning call. And today we have a total of 182 avoidable days across the region.
All right. That'll be an important number to track going forward.
It's very important, and if it continues to grow, that will create its own set of problems for all of us.
Let's talk a little bit more about some numbers. Forgive me while I look down at the card here. Yesterday I mentioned some of the numbers that you can look up yourself. You can go out on the internet and look up the numbers from New York State, and these numbers are new numbers from today that I'd like to share. Let's go back to April 14th. On that day in New York State, they tested approximately 27,000 people for COVID-19. And on that day, 11,500 of them were positive. So it was 43% of all the people they tested throughout the state were positive. If we look at the data from May 19th, so about a month later, 38,000 were tested, and 1,525 of those were positive. So that's 4%. Then I went ahead and I looked at the 8 counties in the capital region, and I just added them up myself. And on that same day, May 19th, we tested 2,112, and 42 are positive. So that's just about 2%. So half of the statewide average.
And Dennis, this correlates with the change we've seen in hospitalizations. That's gone down dramatically as well over that time period.
Yeah. Today is a very important day in the capital region. As we mentioned, we've entered phase 1 of businesses opening up. The last thing that needed to be done is the counties needed to have enough people to do tracers. They needed 30 people for every 100,000 people.
That's right.
So the counties now have the people who could do that tracer work, meaning if someone is positive for COVID-19, they need a human being who can look at that person and find out contacts they've had.
That's right.
Now that businesses are open phase one, what's different for us in the medical center?
So honestly, Dennis, not very much. Last Wednesday, Albany County crossed the threshold to open for elective surgery without a waiver. So we're doing elective surgeries in a controlled fashion this week. And so really, this doesn't change anything for us. Although I think that it probably has led the governor to think about relaxing some of the visitation restrictions.
Right.
And so we talked a little bit about this yesterday. We're going to be part of a pilot to relax those restrictions and see what happens. So we think tentatively tomorrow we're going to change things a little bit here. There's going to be a 2-hour window, we think tentatively from 4 to 6 p.m., where we're going to allow one visitor to come in and visit a patient here in the hospital. We're going to screen that person, so we're going to temperature screen, we're going to screen them for symptoms before we allow them to come in.
Right.
We're going to have them do hand hygiene as they come in, and when they get to the floor, if they're visiting a COVID positive patient or someone we suspect might have COVID, we're going to require them to wear all the same garb that our staff wears. So a face shield, a mask, gown, and gloves.
Now that leads to an interesting question. So we've talked about it's as important how you put on the PPE as you take it off.
That's
so
right.
we're going to have some visitors who will be wearing PPE and they're not familiar with how to take it on and put it off. So what are we going to do about that?
We're going to very carefully walk them through both
Okay.
the donning and doffing of that equipment to make sure they put it on correctly to start, and then they don't contaminate themselves when they take it off.
That's very important.
So this is going to be a significant effort for visitors who go see patients who are COVID positive or PUIs. The other thing, this is going to be a point-to-point circumstance. They come in, they're going to go to the patient's room, they're going to have their visit, and then they're going to leave the organization. So they're not going to be able to walk around, go to Dunkin' Donuts, cafeteria, all the other places that they might have gone at other times. We really want to be careful and not spread anything around the hospital
Excellent.
through this. And this will be for 2 weeks. I think the state then, we're one of 16 hospitals, the state then will look at what's happened and we'll probably open this up to more general hospitals.
Sounds like nursing leadership here, Mary Alice Cullen,
Mary Alice,
security,
yeah.
a lot of people working
They're
on this.
meeting, security and Mary Alice, they're meeting right now to work out some of the security details. Mary Alice has been on point, done a tremendous job
Thank you.
putting this together for us.
All right, thank you. 2 final items. For our internal workforce, I mentioned a couple times now there are some videos that have been made by our Albany Med Fitness team that are on our intranet. If you'd like to go online and check out some of those videos, I think they're up to 13 videos, Fred.
Yeah, that's great.
And we've promised to do a yoga one here one day.
Did we?
I think we did.
Okay.
And so check those out if you'd like to. They're great videos, and we thank Albany Med Fitness for doing them. And then lastly, tomorrow's graduation.
That's right.
This is the 182nd graduation for Albany Medical College,
Yeah.
which is one of the oldest medical
One
schools
of
in
the
the
oldest
country.
medical schools in the country. That's just unbelievable, isn't it?
And you might think that Albany Medical College only graduates doctors, but you would be wrong. So
That's
we're going
right.
to talk about that tomorrow. We graduate a lot of different disciplines,
A lot
and
of
we'll
different-
talk about them
A lot
tomorrow.
of different students graduating tomorrow.
So if you don't get a chance to see this tomorrow, and if you are a graduate of our medical college, we congratulate you. And if not, tomorrow we'll talk a little bit more about the graduation,
Yes.
which will be taking place here on campus. It'll be a virtual graduation.
Virtual, it actually looks like it's going to be quite interesting.
Yeah, should be good. So.
Looking forward to that.
Okay, we'll be back again tomorrow, graduation Thursday. That'll do it. We ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.